Excellent. Thank you, Emma. Hello, everyone, and thank you for joining FP 2020's webinar on understanding data on adolescents and youth. My name is Emily Sullivan, and I'm the Adolescents and Youth Engagement Manager for FP 2020. First, I'd like to tell you why we're having this webinar, and then I will give you an idea of how this webinar will be laid out for today. So essentially, we're having this webinar because many of you asked for it, including Mansa and Andrew, who are two young reference group members. They will be leading the discussion today. As you hopefully know, FP 2020 launched an annual progress report at the International Conference on Family Planning at the end of last year. In that report, we have a special analysis on adolescents and youth. The publication of the report and the special analysis is a success in itself. However, we all know that publishing isn't enough. Many of our partners, especially young people, are really thirsty to understand data and want to use it in this work. So we're having this webinar to make sure that we can do that together as best we can. So today we have, the webinar will be laid out in 3 sections. First, we'll have Jason Bremner of FP 2020. He's our Director of Data and Performance Management, and he's going to share the latest and greatest of adolescent and youth data. Then we'll have our 2 young reference group members, Mansa Priya Vasudhari of YP Foundation in India, and Mbensho Andrew Milan of Youth Health International in Cameroon, and they're going to lead the discussion after Jason presents. They're going to ask him some of the questions many of you commonly ask about what the data means and how we can use it. Then we're going to open it up for the group for lots of comments and questions. So before Jason wows us all with data, first I'd like to ask my colleague Emma to explain a little bit about the features of the webinar and some other logistics. Over to you, Emma.
Thank you, Emily. Thank you all for joining us for the webinar today. Before we get started, I want to show you some key features of this webinar. If you look at the bottom, you will have a place where you can submit questions regarding logistics. If you can't hear any audio or you're having trouble with your screen, please ask those questions in the chat bubble. It should be at the bottom of the screen. And then also, if you have any questions for the Q&A portion of the presentation, please ask those in the box also found in the bottom. If you have any trouble reaching us, the chat pods, please email info@familyplanning2020.org. Thank you, and on to Jason.
Thanks, Emily, and thanks, Emma, for organizing this webinar today. And thanks, Andrew and Mansa, for joining us at this late hour in both of your places. Good morning, good afternoon, and good evening. I'm Jason Bremner. I'm FP 2020's Director of Data and Performance Management. And today I'll be providing an overview of our special analysis on adolescents and youth, helping you understand the data and also looking at some of the challenges that we still face in gaps towards better and more understandable data on youth and adolescents, contraceptive use, and sexual and reproductive health. Ahead of the 2017 Family Planning Summit, partners who were focused on this theme, on adolescents and youth, were asking many questions about data, some of which we could answer, and many of which we could not. So in response, FP 2020 and our measurement partners came together to write a commentary entitled Mind the Gap, a commentary on data gaps and opportunities for action in meeting the contraceptive needs of adolescents. Since then, a number of FP 2020 partners have worked to address the gaps in adolescent and youth data. And one of the steps that we've taken at FP 2020 this year, as Emily mentioned, is to increase data availability in our FP 2020 progress report. So here we report on a selection of themes and indicators recommended by FP 2020's Performance Monitoring and Evidence Working Group for tracking country progress. These indicators include demographic trends, life events, and current levels of contraceptive use and unmet need among married and unmarried sexually active women aged 15 to 19 and 20 to 24. The indicators reviewed here in the progress report section are not comprehensive, and countries should develop a longer list of national and subnational adolescent youth indicators within their own countries and in their local contexts. I'll only talk about a few indicators today that are covered in the progress report, but I'll also show you where you can find a lot more data for those uses. So I just want to remind everyone that since the outset of FP 2020, we have focused on one single core indicator, or core indicator 17 for adolescents and youth. That's the birth rate. To adolescent women aged 15 to 19 occurring during a given reference period per 1,000 adolescent females. I know that's really understandable, so let's work on that one for a moment. You're looking at a 3 to 5 year period and the number of births that occur, and I want to focus on the word births. And I'll come back to that versus pregnancies probably a little bit later or in the Q&A. But in general, the trend over the last 20 years has been toward a decline in the adolescent birth rate. But it's important to note a few cautions in the interpretation of this measure. First, the declines have been very modest over the FP 2020 period from 2012. It's not been remarkable progress in many countries. And second, declines are not necessarily reflective of changes in behavior around contraception or improved reproductive health. Changes in the adolescent birth rate may be due to declines in early marriage, delay of first sexual activity, increase in contraceptive use, or increases in abortion rates. All of these underlying the adolescent birth rate. We do know from research from our partners at Guttmacher Institute that about half the pregnancies among adolescent women aged 15 to 19 in developing countries are unintended. And about half of those unintended pregnancies will end in abortion. But many of our partners have suggested that the adolescent birth rate isn't enough, and we've worked really hard this year to provide additional data beyond the adolescent birth rate, and I'll start diving into that now. So why youth and adolescents? This in front of you, this graphic, I hope you're familiar with, is an age-sex pyramid. And what we see here is a pyramid based on age categories, which you can see on the left-hand side, 5-year age groups, stacked from 0 to 4 at the bottom, all the way up to 100 plus at the top. And we can see here that we have males on the left and females on the right. And when we stack these bars on top of one another, we get a sense of the age structure of a population. Here we're looking at the age structure for FP 2020 countries in Asia. And you can see the orange bars representing 15 to 19-year-olds and 20 to 24-year-olds. And you can see the hash bars, if we add the orange bars to the hash bars, those are our people of reproductive age, 15, 49. What we see here in Asia is that youth aged 15 to 24 make up almost a third of all men and women of reproductive age in FP 2020 focus countries. And in Africa, shown in this next age-sex pyramid, adolescents and youth aged 15 to 24 make up 41% of all women, men and women of reproductive age in the FP 2020 focus countries in Africa. So understanding the lives of young people and their information and service needs is critical for developing effective health programs. Research on adolescence suggests that many patterns related to lifelong health behaviors are established during adolescence. The choices made and the patterns of behavior that young people develop today will affect the entire trajectory of their lives and will affect the trajectory of development in those countries. And moreover, they are the largest segment of the population of reproductive age amongst both these regions. I think the why is clear, but to understand the what and the how, we really need to look at a lot of additional data. So looking at key life events is important for understanding general social patterns in the life course of adolescents and youth. And the patterns that we can look at with available data include age at marriage, age at first sex, age at first birth. And looking across countries, we will see in the next few slides a variety of sequencing among these patterns. These distinctions highlight the importance of understanding local patterns and developing approaches that are context-specific, timely, and effective. This graphic, which is featured in the annual progress report, shows the median age for key life events represented by the age at which 50% of women ages 25 to 29 had experienced their first marriage, their first sexual intercourse, and their first birth. I'm going to slow down for a moment and let's just talk about the age group. Why are we looking at 25 to 29-year-olds? Well, if you want to look at a median for a group, it's necessary that most of the group have experienced that event. For example, look at the median age of marriage for Haiti, which is the line at the very bottom of this graph. And I'm going to see if I can hover a little arrow down here to draw your attention. And you'll see that the median age of marriage for 25 to 29-year-olds was in the range of 22. So you might ask me, well, why are we looking at 25 to 29-year-olds? Why not look at the median age of 15 to 19-year-olds? Well, very few 15 to 19-year-olds in Haiti will have experienced marriage. So to calculate a median for that group would be essentially biased, or it would be a misunderstanding of the true patterns in Haiti. So one of the limitations of the data is that we have to look at an older age group and look back at the age at which these events happen. And so critically, we look at 25 to 29-year-olds and look at the median ages for these events. So it's very hard for me to answer questions, and I'll just head this off now. I can't answer questions on what's the average age at marriage, first sex for most countries for 15 and 19-year-olds today, because most of those haven't yet experienced that event. This graphic's a little hard to see, so let's zoom in a little closer and look at West Africa. So in West Africa, you'll see that countries exhibit diverse patterns with some interesting things to examine. You'll notice that in many of these countries, the median age at first sex appears to precede the average age or median age at marriage, and that would be the comparison between the first sex, green, and first marriage, the orange or yellow, depending on how you see colors. So in the graphic, you can see that in Ghana, there's a long period between the median age at first sex and the median age at first marriage, but then very rapidly after that, first birth. There's almost no spacing in terms of median age between marriage and birth, excuse me. You can contrast that with Senegal, where you see first sex and first marriage very close to one another, but a delay till first birth. So understanding these patterns is really critical. In Senegal, we seem to see some spacing between marriage and birth. In Ghana, it seems that on the average, marriage is followed almost immediately after by first birth. You can also look at Niger here, in which first marriage, or 50% of 25 to 29-year-olds reported that they were married before the age of 16. So in this country, obviously efforts to delay marriage and delay first birth are critical for a host of reasons, including improvements in maternal health outcomes, increasing girls' education, and empowering women. So across all of the countries that we've presented in the report, I urge you to look at these patterns. And if I have a chance, I'll come back to additional data that we feature on marriage, birth, and sex in the Q&A. So in addition to the demographic trends and the key life events, we have a lot of additional data this year on contraceptive use and unmet need, as I mentioned, for married and unmarried sexually active, for both 15 to 19-year-olds and 20 to 24-year-olds. And it's important to look at these separately from one another, and these age groups, and also the married and unmarried sexually active, to better understand patterns in countries. In general, we see a wide range when you look across countries, and contraceptive use among married women, age 15 to 19, ranging from 1%, just 1% in Nigeria, to 53% in Myanmar. So wide ranges across countries. And in general, we know that contraceptive use among the next age group, 20 to 24-year-olds, is higher, though we still see a wide range from 4% in Chad to almost 64% in Zimbabwe. When we look at the contraceptive use among unmarried, as we'll do in a minute, we also see relatively higher rates of contraceptive use among the unmarried sexually active. But among both these populations, we'll see varying levels of unmet need. Now, it's really critical that we understand not just the contraceptive use and needs of those who are sexually active, which is the married and the unmarried sexually active, but that we look at the entire youth population of a specific country to better understand patterns. So let's go ahead and dive into that data in the next slide. I'm going to spend a lot of time here, and both because I think this graphic is challenging, there's a lot of information, but because there's a lot of interesting and important things to understand here. And I want to congratulate my colleagues at FP 2020 and at Track 20 for working really hard to put all of this data into an understandable graphic. So what we see here are two taller bars on the outside of the graphic. So the one on the far left and the tall bar on the far right. And I'll just hover a moment so you can see what I'm referring to. These bars represent the entire population of 15 to 19-year-olds, and over on the right, 20 to 24-year-olds for the Democratic Republic of Congo. So that's the entire population of 15 to 19-year-olds on the right, 20 to 24-year-olds on the left. Now let's just focus on the left side of the graphic and this tall bar here. The different colors here represent married women in dark blue here, and then unmarried in all of the upper bars. So you can see that among 15 to 19-year-olds, 21% of women are married, and the remaining are unmarried. Well, if you were to go to a general survey and look at contraceptive use, you would see that we actually only report data on contraceptive use for the married, it's blue, and for the unmarried sexually active. And by sexually active, we're referring to sex in the last 30 days. So current contraceptive use is only reporting on about a third of the population of 15 to 19-year-olds. The other 2/3 are these upper bars. And among these upper bars, we have those who had reported sex in the last 3 months, but that would be not in the last 30 days, sex in the last year, ever had sex, but not in the last year, and then almost 50% of 15 to 19-year-olds have never had sex. So why is this important? Well, if you were to look at contraceptive use or unmet need in countries, looking in a demographic health survey or a PMA 2020 survey or a mixed survey, you would be looking at just a third of that population. And you can see here, these inner bars then represent contraceptive use and unmet need for these subpopulations. And so here, if we look closely, we can see that contraceptive use among 15 to 19-year-olds who are married, just 5% of those married 15 to 19-year-olds are using contraception. And I mentioned that that contraceptive use among unmarried sexually active is generally higher, and you can see that here. You do see that 20% of unmarried 15 to 19-year-olds who've been sexually active in the last 30 days are using a modern method of contraception. But if we were to look at just that 5% and that 20% together, we're really just looking at about 3% overall of 15 to 19-year-olds that are using contraception in the DRC. So it's really critical to understand there's a lot of other information and service needs, both among the third here that are sexually active and the 2/3 who are not yet sexually active. But transitions happen really fast, and if we look over at the age 20 to 24, you can see now a really big difference in DRC. You can see here now 60% are married, another 10% on top of that are unmarried sexually active. So just this 5-year age difference, huge transition in sexual activity, in marriage, and based on that, on contraceptive needs. But you can still see amongst these groups that contraceptive use is very low in DRC. So to understand what to do in DRC, it's really critical not just to look at those who've been sexually active, but also to understand the large portions of the population that are not currently sexually active, but transitioning in and out of sexual activity, maybe with less frequency, but still maybe periodically sexually active, or may soon become married and sexually active. So I'm looking at this just for one country because it's really difficult to put all countries into a graphic and look at them together. But what I encourage you to do is to look at all of the data that we have made available in this year's progress report for each country, and to look at graphics similar to this one for all countries. So how do we do that? Well, first, let me say that we've worked really hard to aggregate data across surveys, across countries, into a single space. So if you visit our annual progress report, which can be found at the URL at the bottom of this page, you can find the new data that we're referring to, and you can see it here, we've circled it, estimate tables with adolescent and youth indicator data for almost all FP 2020 countries. We include the data that I have featured here today, as well as other important indicators that will help you to understand patterns across these countries. We also, in this year's progress report, feature a special analysis of early marriage in India. I encourage you to look at that as well. If people have questions about that, about India and early marriage, I'd be happy to talk a bit about that in the Q&A. I just want to say that our work isn't done on adolescent and youth data. We continue to work with measurement partners, our PME working group, or Performance Monitoring and Evidence Working Group, colleagues at the World Health Organization, our critical measurement partners, Track 20, as well as other partners who are exploring measurement and research challenges around adolescent and youth. We still know that exclusion of unmarried women in surveys is common in many countries, and we're still urging our survey partners and governments to include unmarried women in surveys. There are still great challenges to unmarried youth, potentially being reluctant to report on sexual activity in a household survey setting, so there are limitations on the way we're gathering data. And we know that classifications of sexual activity and contraceptive use may obscure understanding patterns of sexual activity and contraceptive use data. I've talked you through that in the case of DRC today, and the importance of looking at all of those other categories of folks who've never yet been sexually active, but also those who've been sexually active but just not in the last 30 days. Finally, we critically lack data on very young adolescents, those who are 10 to 14, and I'm happy to talk about that some more in the Q&A. And also a challenge is whether or not health management information systems or the health register in a clinic is able to capture age on clients and the challenges of collecting the age of young clients. And this is a challenge that we're actively working on and exploring with several partners. Well, I hope I haven't gone over too long and left us plenty of time for questions and answers, and I'm sure we're going to have many and many, so I will do my best to go slowly, try to prioritize questions, and I think with that, I will turn it back to Emily.
Great, thanks, Jason. For an excellent presentation. I trust that many people learned something new in that presentation and also came up with lots of questions that they are just starting to come up with. So over the next couple of minutes, I'm going to invite Mansa and Andrew, who are both members of FP 2020's reference group. They are two people who happen to be young, who are also members of our high-level governance body. So while Mansa and Andrew are asking their questions, I encourage you to type in your questions into the chat box while Mansa and Andrew kick us off here. So first, I'll invite Mansa to go ahead and give the first question you have.
Thank you, Emily, and thank you, Jason, for that fantastic presentation. I am always in wonderment at the kind of work the Track 20 team does to pull together that kind of data. I remember our conversation right after the ICFP, where we met with a small youth group, and this question kind of came up during that discussion, and I think it's important to foreground that question in this webinar. It's a three-part question. You mentioned that there are challenges with regards to collecting data on adolescents, especially when it comes to household surveys. So what are the limitations of household surveys, and what other data sources exist at the moment? And typically, what is the kind of data that one collects on young people in household surveys and these other data sources?
Thanks, Mansa. A great question, and I only started to hint at some of the limitations of household surveys. But let's first let's start with the principal one, and that is that households are randomly selected so that we can have a representative selection of households across a country and across geographies. And then within a household, all members of that household or women of that household who are 15 to 49 are interviewed. So the critical aspect of this is that we're only interviewing 15 to 19-year-olds in the household, one. Two, we're only capturing a certain number of 15 to 19-year-olds or 20 to 24-year-olds based on the household selected. So let's start with the first one. I mentioned that adolescents may be reluctant to truthfully respond to a household survey, largely in the house of their parents, about their sexual activity and contraceptive use. This is something that's difficult to assess, but is something that I think we certainly have to consider. Second is that we will only capture a certain number of 15 to 19-year-olds in that nationally representative sample. So for a lot of countries, we have a limited number of 15 to 19-year-olds and 20 to 24-year-olds who are responding to the survey, upon which we are developing these statistics, like their contraceptive prevalence rate or their median age at first sex. So for those small, potentially small numbers who might report being sexually active, we are calculating a percentage, calculating a median, or estimating it. And there are essentially large confidence limits around those measures because they're based on few individuals. An example is Senegal. If we were to look at the number of unmarried, sexually active women who reported to the survey in Senegal, it's a very small number. It's under 100. If I remember correctly, it may even be under 50. And so any estimates that we generate on that have really wide confidence limits. Think about a political poll and the plus minus that we talk about in terms of our understanding of that, of political polls. So we have those same things in our estimates. So with those wide confidence intervals, it's very difficult for us to track change over time because they can fluctuate very much based on the small numbers. If you wanted to look at, say, then subnationally, those numbers get smaller. So we have small numbers at a national level, and then if you wanted to look at what are the behaviors of 15 to 19-year-olds in a particular province, then we're basing that on even smaller numbers. So it becomes very difficult then for us to track changes based on these numbers. And we're always going to be limited by the number of households that are surveyed. So we can't just capture surveys from more 15 to 19-year-olds because that would require us to capture more surveys from more houses, and that requires more money and more time, and that's a big challenge based on the resources available for data collection. So those are two challenges, Mansa. I'm sure that there'll be some other challenges that are discussed, but let's start with those. And then in terms of what other data sources exist, we'll talk about some of the challenges in health management information systems, but many health management information systems, or what we would say would be collecting age at a clinic level, aren't able to capture data by age group, so that's a limitation. But we do know that there are some other examples of school-based surveys that could be very useful and are very useful in, for example, in the United States. We track adolescent sexual and reproductive health behaviors along with other behaviors through school-based surveys. And we've been doing those for decades, and that's how we track trends for these particular populations. So those are things that could be explored in the future.
Excellent. Thank you, Mansa, for the question. And Jason, for the answer. Andrew, would you like to go ahead and ask your first question?
Yeah, I have a question I would like to get from Jason, but first I would like to appreciate him for that incredible presentation. And Jason, during your presentation, you were able to pull out, some very important data talking about married and unmarried young people. But I would like to have a clarification from you. Are we seeing any improvement on the availability of this data for both married and unmarried people? What do you have to say about that?
Thanks, Andrew. That's a great question. I think the positive news on this is that, yes, we are seeing some improvements in the availability of data for both married and unmarried young people. If we were to look a decade back or 2 decades back, you would see that many countries that implemented our standard demographic health survey only implemented those surveys among married women. So they would select households, and then rather than interview all married and unmarried 15 to 49-year-olds, they would just be interviewing the married on their sexual and reproductive health. We've seen a real change in that. We are seeing a real change in that, and particularly in Asia, where many Asian countries lagged on the acceptability of asking these questions of unmarried people overall. So this wasn't unique just to young people, but of all unmarried people. And so we've seen some real improvement in that as of late. But there are still some countries that don't even ask these questions of I think one of the critical pieces that we hope will change is that all countries will see that it's important to understand patterns of behavior, needs among married and unmarried, and therefore, at a minimum, are collecting these data from both. And we do still see some lagging countries on this front. So thanks for the question, Andrew.
Great. So thank you both for your questions. We see that there's so many questions coming in. So we're just going to hand over to our team at FP 2020 to help answer some of the questions coming in through the chat box.
Great, thanks, Emily. And I'll do my best. Lots of questions, and I'm gonna take them as they come to me. It's not necessarily the order in which they may be showing up in the chat box, and certainly not going to get to all of the questions today, but over time, we hope that our efforts will help you understand the data and be able to answer these questions on your own. So first, I have a question about that sequencing of key life events that I talked about, and particularly someone asked about Senegal, Niger, and Gambia, and whether it's true that, in fact, that these are the most, in quotes, religious countries among the other countries of Western Africa. And I would be cautious with that interpretation. I think across West Africa, there are lots of reasons for the differences in the sequencing of events that we might see. Religion may play a role in that, but we have critical other social factors that are at play in these countries. We've got nomadic populations that are really important in that. We have lots of social constructs around early marriage and around marriage and girls in general. And so I don't think it's a correct interpretation to say that these are solely on religion, and so I would be cautious with that. Obviously, religion is something you should look at in the context of each of these countries, amongst other factors. So I have another question from Alon Kabore, who I believe is soon to join us on the Performance Monitoring and Evidence Working Group. So welcome, Alon, to the group, and welcome to the webinar. Asking about the availability of information and data on adolescent youth access to information and services. It's a great question. In general, we have, I would say, we have few data sources that tell us about, specifically about access to information and services by age. We have some measures that we can look at in terms of the, there are questions in the survey that talk about the counseling that contraceptive users have received. And so that's, that can be looked at in terms of information and services. There are questions in the survey that look at whether or not individuals have received information about family planning. And so there are additional ways in which you can look at the survey data, particularly for these age groups. So yes, access is, I think, a tricky word. So if you want to say access to services, that's harder to measure. There are a lot of factors that are wrapped into access. One is whether or not contraceptive methods are in the places where those young people want to seek services, and then also what are the methods that they're seeking. And this is measures of whether or not people have access and whether or not their choices are met are something that are difficult to understand in terms of a single indicator. We do have some colleagues at the University of North Carolina, Chapel Hill, who are doing research on adolescents and youth and how one would measure contraceptive choice. And I think that project will suggest some better ways in which we can understand the contraceptive choices of adolescents and youth. So I'm glad you'll join our group and be able to learn more about that information. And as that project releases information, we'll be trying to highlight it through our future efforts. So I see next question, which is, I think I've hinted at some of the challenges to this, but this person asked about differences among urban and rural adolescents and youth in terms of uptake of family planning methods. So in general, as we start to, as I mentioned earlier, as we start to slice up our 15 to 19-year-olds in potentially smaller groups, our understanding of the data becomes poorer. So I think in terms of rural and urban, that's probably as fine a slicing as you want to do, right? Because you're already taking a small group, 15 to 19-year-olds, and I mentioned that we're only looking at contraceptive use and unmet need among those who are married or sexually unmarried and sexually active. It's not traditionally available in the demographic health survey by rural and urban. Someone could do that analysis, but I caution you that as you start to slice up these 15 to 19-year-olds, married and unmarried, into smaller groups, your ability to definitively make conclusions upon that data becomes more and more challenging. I don't believe that we looked at urban-rural differences in our data that's available. I'm looking to one of my colleagues in the room right now. And I'm looking to you. Did we, just if we provided urban-rural differences in 15 to 19-year-olds? Okay, so I'm confirming that we have not provided that in the data for this year. And I would caution you with looking at smaller and smaller groups. I think it's really important. I will say that there are some additional surveys that have looked at urban reproductive health in particular. Those projects under the Urban Reproductive Health Initiative have some very specific data on specific countries and geographies that you might want to explore, and hopefully you can reach out to us and we can provide you with some links to those data as well. I have a next question that is asking if we differentiate between in union versus married. thanks for the question, and to clarify that the in union and married are grouped together under what we've shown here in the graphics or in our data files under a single category, which would be in union / married. So we don't differentiate in general between these groups in surveys and in analysis, and across countries, these categories can get very fuzzy. So in general, not in general, across all survey types, we group together in union and married. All right, so the next question we're hearing from a number of people, which is asking me to focus a little bit on the limitations of data on 10 to 14-year-olds. So I hinted at this, and first to say that our standard data sources, these household surveys that I've talked about, I mentioned that they go to the household and they interview all women and girls from 15 to 49. 10 to 14-year-olds are not included in those household surveys. And there have been calls for including 10 to 14-year-olds in surveys. A couple of comments on that. First, I think the questions that exist in the demographic health survey probably would not provide us with the information that we would really need from 10 to 14-year-olds to understand their particular sexual reproductive health needs, patterns, trends. So one is whether or not the existing survey tool that is really focused on 15 to 49-year-olds would really tell us what we need to know. And many among the adolescent youth data community ask that same question of 15 to 19-year-olds. You know, are we asking the right questions? And there are some interesting efforts underway at a project called PMA 2020 to look at what are additional questions that we would need to ask of 15 to 19-year-olds. That same question would apply to 10 to 14-year-olds. But in general, we aren't collecting data for 10 to 14-year-olds. So our first big gap is it's not collected. And most countries are reluctant to even to think about asking or including those folks in surveys. The second is whether or not, when we're talking about sexual activity, we would have very few 10 to 14-year-olds who are sexually active. So you would essentially be doing a lot of surveys and finding very little sexual activity. So there is a question of how much data you would actually be able to gather and analyze for this group based on the same issues that I talked about earlier. I will say, however, that there are some great sources of data for 10 to 14-year-olds. There is a specific study hosted by Johns Hopkins University, the Very Young Adolescent Survey, that has been doing surveys amongst 10 to 14-year-olds for the last several years. It's providing some great information in some countries, and I encourage folks to explore that data. And then to say that one of the things that has recently been released is that in the demographic health survey, there is data that looks among 15 to 24-year-olds, asks them questions, retrospective questions, in which you can look back at their lives between their essentially sexual and reproductive lives between the ages of 10 to 14. So there are some creative things that you can do with the existing data to look backwards. And the Demographic Health Survey released a report last year that does look at what we call the calendar data and looks back at 10 to 14-year-olds. So great limitations out there, but I encourage people to look beyond those limitations and start to look at some of the sources that do exist. All right, I'm going to just scan down a few more questions here. I mentioned that I might come back to the changes being seen in India based on the data. So one thing that I think is interesting, I encourage you to look at it in the progress report, is the change in early marriage in India that we've seen between the NFHS 4, or the National Family Health Survey 4, and the National Family Health Survey 3, which was a decade prior. So between these surveys, 10 years apart, what you'll see is a drastic change in the percentage of women who were married before the age of 18. And then when I say drastic, we're talking about very, very large declines and unprecedented across South Asia and across much of the rest of the world. So it's interesting because if you were to actually look at the median age at marriage, it's not changed, which means for those people who got married early, they got married around the same age. But when we look at what percent actually got married, it's a huge change. So we're seeing a really large delay in marriage in India. And this has implications for contraceptive use. If you're delaying marriage, it means it's also delaying, in India, in the context of India, delaying first sex. And so we are seeing then delays in the uptake of contraceptive use. But that's a good thing because people are getting married later. They're having greater opportunity to fulfill their education and employment desires, and so we see that as a positive thing. Though it does mean that contraceptive use, it sort of it slows down contraceptive uptake in India. So interesting, important to understand those dynamics of the key life events and how it has ripple effects on other measures. Going to continue to work down here. So one question I see is how difficult is it to include questions about unmarried adolescents into the DHS that take place in all countries? Has this been considered? This would help in getting the data for decision making as far as this age group is concerned. But thanks for the question. In most countries, these questions on contraceptive use, on a related to unmet need, are asked of all adolescents, regardless of marital status. And then for some countries, there's essentially an exclusion. When you get to the household, you only ask questions on these topics of the married people in the household. So how difficult is it to include those questions? The questions are actually the same, right? We are essentially asking the same questions of married and unmarried. It's just that in some countries, they choose to not ask the unmarried adolescents. And I should say, it's not just unmarried adolescents, it's all unmarried. So it's not difficult from a survey standpoint. It really comes down to a social context and political decision on whether or not to include those folks in the household survey. So from our perspective, this is being done in most countries, and there are just countries that have not yet broached the politics of this and the social aspect of asking those questions of both married and unmarried adolescents. And we urge all countries, as we do in the the Mind the Gap commentary that I mentioned to collect data for married and unmarried adolescents. So this isn't so much a question, but an opportunity for you all to take action on this front. I've heard from one of our close colleagues, Carrie McQuarrie at Demographic Health Survey, who wants me to remind all of you, if you haven't yet seen it, that the Demographic Health Survey program is currently in its process of reviewing its data collection questionnaires, and has an online portal that is available for submitting questionnaire suggestions and question suggestions. That portal is open through March 15th and is a great opportunity for all of you who have expertise in this area to comment on the DHS questionnaire, which is such a critical source for our FP 2020 countries and for adolescent and youth data. So thanks, Carrie, for that reminder. So the next question is looking at the adolescent birth rate. And I'm glad we're coming back to the adolescent birth rate. I probably could spend, I don't know, we have 30 more minutes. We spend 30 more minutes on the adolescent birth rate. Maybe not, but I think we could spend a little bit of time on understanding the limitations of the adolescent birth rate, and maybe clarifying a bit on its meaning. So the adolescent birth rate has been a critical indicator for the Millennium Development Goals, for ICPD, and is one of the SDG indicators. So I don't want to underplay its importance, but it does have limitations on being reported on its own. The first limitation to note is that there's a difference between an adolescent birth rate and a pregnancy rate. So the adolescent birth rate, as I mentioned early on in the webinars, about births to a particular age group. We can talk about 15 to 19-year-olds over a certain period. It is not pregnancies. And so, first, I suppose in terms of understanding adolescent youth data, to all of you advocates out there, I urge you not to interchange these because we don't measure pregnancies, we measure the births. And so what's left out of that are pregnancies that may be ended either spontaneously due to abortion, and so there is I think a big difference between understanding a birth rate and the pregnancy rate. Now, we don't have the tools to calculate pregnancy rates, but it does suggest that there are other factors at play in a country, and I think you do really need to understand not just the adolescent birth rate. So what are some of the additional indicators that I think are critical for understanding? I think that a few of them are the ones that we have talked about here today. I think it's really important to look at the statistics around the age at first sex and marriage, as well as first birth. And I would urge folks not just to look at the medians that we've provided and talked about today, but also in our data file, we look at the percent of women who are married before the age of 18. And I think that that's a really critical indicator to understanding needs in a country. I think we all agree that early marriage has great impacts on girls, and I think it's a critical indicator that also will affect the adolescent birth rate. I also think that looking at contraceptive use separately among married and among among unmarried sexually active is probably the other indicator. Though I really urge people to, in that context, to understand what proportion of 15 to 19-year-olds are actually sexually active, because those data can be misleading if you haven't looked at what percent have been sexually active in the last, as we defined earlier, meaning either married or sexually active in the last 30 days. So I don't know if that's a small set of indicators, but I think we do need to supplement the adolescent birth rate in our global measures to better understand trends and what's needed. So I think with that, I've tried to answer a large portion of the questions, and I want to maybe just turn back to Emily or Mansa and Andrew for some maybe some reflections or other critical questions that you feel like I haven't answered.
I think this is Emily. I'll keep it very short. I would just like to encourage everyone on this call, especially those who maybe don't consider themselves to be data experts, to learn to love data as best you can. I didn't start out my career as interested in data or thinking it was particularly important, to be honest, but I've started to join things like this early on in my career and started to just become more curious and realize how important it is. So if you found yourself confused at all during this webinar, especially if you're a young advocate, a young professional, I just encourage you to keep with it, try to learn as much as you can, because we all know that it's really important to understand this data and how to use it. Mansa and Andrew, any other thoughts?
Hello?
Go ahead, Andrew.
Okay, I still want to appreciate Jason for taking our time to answer those questions. And I really believe that Jason and his team are doing a lot, because previously we didn't have data available for young people. And over the years, they have worked so much to see that we have data for young people, and we are able to use this data, to be able to carry out planning and advocacy work that is meaningful. So we have to acknowledge that Jason and his team have been doing an excellent job. It's true that there is still so much gap. There are a lot of gaps that are involved with data for young people, and they are working towards seeing how to, meet up with those gaps and all that. One thing that we should also put in mind is, in as much as we have this data, we must be able to see how we can be able to make use of this data. There is no need for us having data that is available and we are not able to, make use of it, and to see how we can actually, contextualize this data in our respective countries, because we have the reports that are out, and if we go through the FP 2020 reports that came out during the conference in Rwanda, we are going to see data for our respective countries, and I think that is an opportunity for young people, young advocates all over the world to be able to study the data for their respective countries and be able to see what is important and how they can be able to use that data to carry out the advocacy work that they are already doing in their respective countries. I believe that it's going to be a very powerful tool if they can be able to use this data, because I'm talking from my personal experience. When I was able to have data for adolescents and young people in Cameroon, it helped me so much in my advocacy work. I was able to meet with policymakers and stakeholders, and to hold them accountable for some of to hold them accountable for some of the gaps in the area of adolescents and youth sexual and reproductive health, family planning in the country. So I just want to encourage everybody here, all the participants, that we should be able to use the data that we have to be able to, continue with the advocacy work that we are already doing.
I just unmuted myself. I was talking to myself apparently a little before this, still getting a hang of the webinar and conference and Zoom in general. But I just wanted to, of course, thank Jason for patiently answering all of our questions. And I'm really glad that we addressed the difference between adolescent birth rate and teen pregnancy rate, because I think that's an important clarification. And I'm glad we kind of foregrounded that in the conversation towards the latter half of the conversation. And I think I just want to sort of add that I am glad that Jason also acknowledged that apart from the challenges being sort of, the challenges are numerous and intersectional, there are definitely legal challenges as well. Law acts as a barrier in many countries to obtaining the kind of data and nuance that we want with regards to data collection. Legal age of consent, laws governing marriage are, all sort of laws that come in the way of collecting this data as well. So it's important for us to pursue some amount of legal advocacy in order to free up, data collection and, in order to sort of disenfranchise data in general. And I think another important sort of the caveat I might want to add is that in our sort of in our fervor to collect data, because it's high time we started collecting data on unmarried adolescents, especially unmarried adolescents between the ages of 15 to 19. I urge us all to keep in mind that confidentiality is top priority, and that we never sort of like compromise on that, because then we will only sort of disincentivize or discourage young people from accessing these services in the first place. So even when it comes to like tracking abortion, which is a common sort of bone of contention in in usual civil society discussions, just important to constantly remember that we're still struggling with making these services respect privacy and assure quality of care to the patients, and therefore confidentiality is something that we should not compromise on along the way.
Thanks, Andrew and Mansa. And I think, Mansa, you bring up an important point that maybe I didn't adequately talk about, and that is some of the ongoing challenges about age disaggregation, especially at the health center level. And there are a number of questions or comments about this in the Q&A function, and I'm sorry I can't get to each of them individually, but there are some questions about about reporting of age within the clinic setting, and requirements either from donors or the Ministry of Health about getting different age categories, whether that's 10 to 14 or 15 to 19, 20 to 24. One of you mentioned, Mansa, the legal implications. We do know that sadly there are still some countries in which services are or the provision of services is dependent on age, and that there are restrictions around who can receive services with or without the consent of parents. And so one of the things that we want to be really careful about in terms of making recommendations or requests for data at that service provider level is that we're not, as you mentioned, endangering the access to those services from a young person or an adolescent who would be reluctant to provide their age, or a service provider who may be reluctant to record the age of a client who does not meet those age restrictions. So there are some, I think there are some legal questions. There are some ethical questions also about whether or not, even in an environment where it is legal to provide services, if there are biases among providers about the age at which young people, youth can come in and receive services, that asking the age of a client could also prevent or provide a barrier or create a barrier to information and services. So this is something that, as I mentioned, it's a challenge that we're actively exploring right now. There is some work being done by WHO that's looking at age disaggregation in service statistics systems, both among private providers and at government levels. And we don't have I don't have a clear answer in terms of recommendations at this point, but it's something that we're actively working on, that we'll be reviewing over the coming year in terms of the findings from those studies, and hopefully coming back to the community to with some guidance and some recommendations. So thanks for that important point, Mansa, and for the questions from all of you about that. So there was also just a question about would we be able to answer all of the questions that have been asked. I don't know that we'll go one by one, but we'll see whether we can as we post the recording of this webinar, if we can provide a few general answers to some frequently asked questions. I think that's something that we back to and explore with my team, and see if there are some critical questions amongst those lots that were asked today that we think need to be answered or been asked multiple times that we just haven't covered. So definitely we'll try to get to some of those frequently asked questions and provide everyone with guidance on those. So I think with that, I'll turn it back to you, Emily.
Great, thanks, Jason. I know we're a good 15 minutes over, but we're still at 121 attendees. So I'm genuinely impressed by everyone's commitment and interest on this issue. It's not surprising to me that you all decided to stay on for so much longer, because this is arguably one of the most popular topics, one of the most important topics for our partnership and for our community. So I appreciate everyone who has stayed on and encourage you to stay in contact with us. Make sure you follow us on the newsletter and on Twitter. Whoever's managing this slide deck, could you click back to the slide with the URL for the progress report? So please do take a picture with your phone or write this down. Depending on your age, you'll probably choose one or the other. Just a little joke there. But take note of this URL, and especially where that red circle is to download the tables. Our colleague Shiza put a lot of effort into developing those tables, and please do take a look at them and use them in your work. We look forward to working with you all going forward. Thank you for your commitment to the issue. Have a good day wherever you are in the world.
And just the last announcement to say that we will send a follow-up email with some of the links we've mentioned during the call, as well as a link to the presentation. Thank you very much.